Good morning and welcome to another in the Elephant series on the COVID-19 pandemic and various responses to it, especially as they affect Africa. Today, I'm very privileged to have with me a leading African political scientist, Dr. Ato Kwamena Onoma, who is head of the research program at the Council for the Development of Social Science Research in Africa, CODESRIA, that is based in Dakar in Senegal. Good morning, Ato. I think it should be around 9:30 your time.
Yes, you are right, John. Good morning.
Good morning. Thank you very much for making the time to join us today. Let me just start, Ato. What's life like? Are you under lockdown in Dakar? What kind of measures have been implemented to deal with the pandemic? How serious is it and how has it affected your work? How's your family?
Thanks, John. I think we are doing well given the circumstances. Dakar has just around 500 cases, but we've seen the gradual implementation of a series of measures. So there isn't a lockdown, but there is a curfew. There are laws against assemblies. Schools have been closed. Places of worship have been closed for a while. Interregional travel within the country has been stopped. And then, of course, the borders of the countries have been closed for a while now. So I have been working from home and trying to juggle working and then homeschooling and trying to stay sane. So it's challenging and interesting at the same time. How are you and how is your work going? How are you in Kenya?
We're well, just very much like yourselves. We have a curfew from 7 in the evening until the morning. We also have a lockdown in effect. The primary measure that the government has implemented is this physical distancing. So all restaurants have been closed. And Kenya is a country that depends heavily on tourism, and that sector more or less has shut down. We are allowed to, we're encouraged to go out. We go out to shop for groceries. When you do that, you wear a mask. It's mandatory now and enforced by the police. Everybody who goes outside must wear a mask. You wash your hands. As you go into a supermarket, you wash your hands. Definitely in terms of behavior change, a range of measures have been implemented that we are learning from our brothers and sisters in the East and also in the West as they respond to this crisis. So I was telling friends that I actually had to spend 14 days in self-isolation because I flew into Kenya from the US and the UK on the 13th of March, about 2 days before the curfew. And it was interesting, Ato, in that when I passed through JFK Airport in New York on the way here, the officials there were not wearing masks. There were a few people, mainly Asians, who were wearing masks in the airport. I didn't see much of that amongst officials at the airport. Same thing in Heathrow. And it's only when I arrived in Nairobi at the airport that the officials were wearing masks and gloves. Our temperatures were taken. I was asked where I had been, and my name was taken, my mobile number was taken, my residence address was taken. Yeah, and I spent 14 days not leaving the front, the door of the house. So maybe that leads me to pose a question to you, Ato, as a political scientist and somebody who's at a unique vantage point in being able to view developments with around COVID-19 across the continent. How would you characterize the African reaction to this pandemic? I mean, as I said, I got the sense that actually we were quicker than many other parts of the world. The Asians were very quick, but when the Africans kicked in, partly because we know our own limitations, we moved quite hard, and we had a bit of infrastructure. In Kenya, the infrastructure that we were using of temperatures and all that comes out of the Ebola crisis, that kind of thing. But how would you characterize it, Ato?
Yes, I think I entirely agree with you. I mean, there are ways in which the measures that many countries have imposed are similar to those imposed elsewhere. So curfews, lockdowns, the use of a mask, and things like that. I think the big difference has been with regards to temporality. When you look at timing, you realize that many of our countries imposed those measures much, much earlier, sometimes before they had any deaths, sometimes before they even had any confirmed cases. And I think I have been impressed overall by the awareness of many of our governments that we may not have the capacity to deal with large numbers of cases. So our best bet is in slowing the spread of the disease. And I think that's what informs the speed with which we have imposed these measures. And I think, we have to take this with the weight that it requires, because these measures are extremely costly economically, extremely disruptive socially. So when you think about Kenya, for example, with its tourism and hospitality industries, shutting all of that down is a big thing. So these are big decisions that governments have made, and we hope that it will sort of slow down the spread of the disease, so that before it gets too bad, we will be closer to a vaccine or to an approved cure.
Let me ask a question that emerges out of a comment that you made when we were chatting earlier. You said that diseases happen. Epidemics and pandemics are made. Can you just throw some more light on what you meant when you said that?
I mean, so I think this is something that is widely understood within the scholarly community, that, we have a case where, we have an infectious disease. We can understand that as a biomedical event. But the responses around that, our reactions around that, what we broadly think of as epidemic control and prevention measures, these are social and political decisions that we are making. For example, are we going to lock down the economy, or are we not going to? Are we going to impose the wearing of face masks, or are we not going to? Are we going to try to prevent the virus from spreading, or are we going to allow the virus to spread so that people develop immunity to it? Are we going to curtail trade to reduce the spread of the virus, or are we not willing to do that and will allow trade that will lead the virus to spread more? So these are all decisions that we make. They are deliberate decisions, and these are really what's build what we think of as an epidemic or as a pandemic. So it's very useful to think of it as a social event instead of just as a biomedical event.
You mentioned there, just in passing, just the role that academics and researchers and experts play. And you're sitting there in Dakar, in the premier African social science research center in all the world. CODESRIA is the one that brings together the greatest concentration of minds into the social sciences on the planet, as pertains to African people. And one of the questions that I wanted to put to you as a member of this fraternity of academics at this time, what opportunities and challenges does this pose to African academia? We've seen a trend, especially since the late 1980s, with the structural adjustment and also very authoritarian leaders who have a disdain for the academy. a disdain for academics who are called dissidents, and and so a lot of the brain drain that took place in many of our countries from the 80s and 90s was as a result of backward leaders essentially afraid of their own academy. Does COVID potentially promise a change to that? In that, talking to different academics, which is what we've been trying to do over the past few weeks, is to reach out to African experts so that we can nuance this pandemic and what impact it's going to have politically, economically, and socially. What does this pandemic mean for your fraternity, for the academy, for experts, for respect of the kind of thinking and nuancing and research that you do?
Okay, I mean, maybe let me start in very practical considerations of our lives now. And I think the pandemic has been very disruptive to an extent, because there are certain things that academics usually do that we can't do anymore. For example, going out to the field to do field research, for example, organizing conferences where we meet and discuss and things like that. But there are also ways in which the break is sort of propitious for academic work or intellectual labor, because it's precisely because it sort of curbs movement and a lot of other activities. It gives people more of a time to sit and reflect. And if what you do is write and read, and you do have the books in your house, or you have access to them online, then you can do a lot. And I think it is a good time to reflect and think. And I mean, for us as CODESRIA, when we think, one of the things that we think about often, almost always, is the extent to which Africans are telling their own story. Yeah. And I think, yes, the pandemic does raise that question, because we are talking about a pandemic, but really another way to think about this is that we have a series of epidemics happening in different places around the world simultaneously, because the way it's playing out in various places is very different. For example, you look at the population profile, many African countries are extremely young.
Correct.
Europe, you have large sections of the population that are extremely old. And so obviously the way the pandemic plays out in Europe will be very different from how it plays out in Africa. And we need people who know the continent to be able to understand and reflect on how it will play out in the continent. So it's very important. And I think, like you said, for too long, we have sort of neglected academia, or even cracked down on academia. We tend to see academics as people who are not too useful, that we can neglect, or even as troublemakers that we need to deal with. And these are not just historical attitudes. We see these attitudes even today in some countries, where it's not just academics, but anyone who is willing to debate and to question is sort of seen as a problem. Yeah, there are still many of our countries where you have that. And it's not just the state, but sometimes it's market actors and things like that. And I think, the continent sort of has to reflect on its relationship with those who produce knowledge about it in the continent. Okay. Because, one of the things we see with the pandemic is the importance of knowledge, the tentativeness of knowledge, and the importance of people who pose critical questions about what we think we know. And every society needs to have its share of people who do that sort of labor. It's important, just like we have our share of people who do leadership, our share of people who do economic activities. We do need people who are dedicated to intellectual labor. And it will be very difficult for us to understand and deal with many of these issues if we do not have people like that.
Talking of the transience of knowledge, Dr. Ari, one of the anecdotes or current ongoing developments that is quite striking is, for example, uh, the approach that has been taken to the pandemic by the Tanzanian President Magufuli, um, um, the approach that has been taken by the Swedish government, which are quite different from what is being adopted in other European countries, and what's happening in Tanzania is quite different from what has happened in other African countries. Can you just comment and reflect on that in terms of nuancing approaches to the COVID-19 pandemic?
Okay. I think, with pandemics, just like with many important social crises, there are always alternative ways of approaching them. The cost and benefits of each of these approaches are different. I think it's also important to emphasize how much we still do not know yet.
Mm.
Okay, how much we still do not know.
Yes.
And I think once we have that in mind, we can be more tolerant to debate and to experimentation. For example, a few weeks ago, we were told that you don't need a mask if you are healthy.
Yes.
We're told that actually wearing a mask puts you in greater jeopardy.
Yes.
And just a few weeks later, we have many countries where if you don't wear a mask, you'll be fined by a police officer or even sent to jail or put in quarantine, because we believe that it's absolutely important for everyone to wear a mask. There is also a lot of questioning about immunity. We are still not sure whether those who suffer from the disease and recover have immunity, how long they have immunity for, when immunity kicks in and all of that. So there are still a lot of things that we don't know in terms of scientific knowledge. But I think when you have crises like this, dealing with them requires marrying scientific knowledge with knowledge of local context. Yeah. So like I said, it's probably more useful to think of this as a series of epidemics that are happening simultaneously in many places. And the way they play out, the measures that will be appropriate to deal with them in different contexts will vary. And so I think once we know that the idea that there is one approach that will deal with a crisis is problematic, one, because we don't know that much yet, but also because what might work in one place may not work in another. And the cost that a society that might make sense for one society to accept may not make sense for another society to accept, because its cost-benefit ratios can be calculated in very different ways because of local context. Yeah. So I think because of that, we probably should be more tolerant. Now, having said that, I think there are certain responses that we can say are problematic. So, for example, we still have people talking about having found a cure to the disease, asking people to go out and pray. Maybe I should not let my anti-religious biases come into play in this, but I think some responses, especially when they are from opinion leaders and from leaders, can be highly problematic, especially when they flout experiences that we have had with dealing with epidemics and pandemics like this going back into history. Okay, because what we are using, the toolkit that we are using to deal with this crisis, is not just what we are discovering from this crisis, it's also the legacy that we have from dealing with previous crises, So the point you made about getting to JKIA and then having your information taken and all of that, that's a legacy of the Ebola crisis in DRC. And I think there are many African countries that have this legacy of experience of dealing with pandemics and epidemics that are bringing this to play in this crisis. And so telling people that it's all right, you should just go out and pray and it will help with this disease, can be problematic, I would say.
Yeah. One of the aspects of the response that we've seen across Africa, which people are commenting on more and more, has been the securitization, the militarization of the response. What are the political and social, I mean, first of all, what's your comment in regard to this? And what can you foresee as being some of the consequences of this securitized, militarized response to what is essentially a health issue that has led to a response that has had such a major impact politically, economically, and socially?
I think, going back to, like what a pandemic is or what an epidemic is, if we agree that these are major social political events, then it's unavoidable that the police will be involved, that the military will be involved, that law enforcement will be involved. And this is not unique to the COVID pandemic. If you think about the Ebola virus disease outbreak in West Africa, you had many of the important global powers sending military teams that are specialists in dealing with biological hazards to those places. Yeah? And you see this sort of response everywhere because confining people is a political act.
Yes.
Yeah, it's a political act.
Correct.
And usually when you confine people, you are sending them to prison. Right now, we are being confined in our places. Some of us are doing it willingly, others less willingly. And who are the specialists in confining people? It's law enforcement. Okay. Now, having said that, I think the relationship of the law and the state to societies and to people in our communities is something that has been debated forever. I think on one hand, there is a sense that African states are not capable, they are weak, and then on the other hand, there is this understanding that African states can be extremely repressive and abusive in terms of how they deal with communities. And I think in certain ways, the pandemic provides a platform for the display of those relationships between the state and communities. And you hear stories. I was reading an interesting story where the headline was that the police have killed more people than COVID in Nigeria. Or you have videos of police beating up people, brutalizing people, and all of that. And so, in a sense, we have another situation where we are sort of displaying or performing this relationship. But it's also interesting because the pandemic is providing new opportunities to develop the capacity to control people. And it's not just in Africa, it's across the world. For example, there is massive gathering of data on people that can be useful for dealing with the pandemics, but that can be useful for controlling society for other means or towards other ends as well. And I think these are issues that we have to think about. Certainly, life after COVID will not be exactly the same as life before or during COVID. But the ways in which it will change and the ways in which it will remain the same, I think, are probably some of the important questions that as social scientists we need to reflect on.
Thanks a lot, Ato. If I was to ask, I mean, one of the areas of speciality in terms of your own research in the past has been just intra-Africa migration. There's a lot of airtime consumed, particularly in the West, with the migration of Africans into Europe, into America, etc. But actually, the majority of immigration takes place by Africans, takes place within Africa, with all its opportunities and risks and challenges. How do you think this particular critical demographic in our societies is being impacted. With the borders closed, you have large groups of refugees, in particular, whose status within countries is not clear, and how is that? What would be your comment on that, given your experience in this area?
Yeah, I mean, so the border closures have been extremely disruptive for the lives of many people, because there are many people, especially in frontier regions in our countries, that live between countries. So they may live in one country and go farm in another country, or live in one country, but to go send an email, they have to cross the border to another country, or to go to the market, they have to cross to another country, or to go do their rituals, they have to cross to another country. And it's true that this is something that happens all around the world. We do have that a lot in Africa. And when you think about borders that are closed, it's going to be extremely disruptive to the lives of many, many people. And I'm talking about people for whom crossing borders is just part of their quotidian. So they are not people going on long distance trade or going to visit a relative. It's just what they do every day. Having said that, I think we probably need to reflect, to give more attention to refugees and forced migrants, displaced people. Because, and I think this is something that we need to do across the world, because a lot of if you look at it, states are basically taking care of their people. So even when they close borders, a lot of the time they allow their own citizens to come in. And if you look at a lot of the measures that we are imposing, a lot of the time they assume a form of existence that is not valid for many of these refugees and forced migrants. Okay, and to this you can add other people who are basically socially disadvantaged, who don't have the citizenship rights that we assume that many people have in our societies. Okay, so they have very, very precarious lives. If you go to many refugee camps and camps for displaced people, health facilities are almost non-existent.
Yes.
We are talking about ventilators and things like that. But for many people in those places, it's about how you will recover from diarrhea or from malaria or other diseases that are more common in our countries. We think about people staying home. Many people have extremely precarious lives, and the idea of staying home, sometimes they don't even have a home. So where are they going to stay?
That's right.
They're thinking about social distancing. If you go to many of those camps, people are really crowded into very tiny spaces. Many of those camps don't have water. They don't have, so a lot of these are things that are actually for disadvantaged communities. And in many of our countries, the most disadvantaged are often forced migrants. Okay.
What would you say is going to be the impact of COVID, or what could be? Where are the opportunities that emerge out of this COVID pandemic? I don't know. It's too early to tell, but there are those who are concerned that some of the new measures that have been implemented to respond to the pandemic, especially those measures that restrict people's personal freedoms, may have a measure of resilience, that some of these measures, once implemented, are difficult to remove. So I wanted to seek your comment on that. But just to tie that up with another question, which is, to what extent does this help to wake up African leadership about the need to invest much more deliberately and in a much more serious, transparent way in their health systems, in their education systems? Because right now, many of our leaders are stuck in our capitals, unable to jump onto their jets to fly to Europe for treatment. If you get coronavirus, you have to be treated at home. And in many of our countries, we have weak health systems. and sometimes, like in a place like Kenya, it's not only weak, but it's also fragmented. So we have a mixture of private and public, and a slow, sort of decline in seriousness in which the government interacts with the public health area as a whole. So I'll be keen for your opinions on
that. Thank you. I mean, I think, one of the interesting things about this crisis is that they keep on reminding us about persisting problems. And they keep on showing us the dangers of those sorts of problems. Okay, so for example, you talk about, early on we talked about our knowledge production systems. And when you think about this, important components, of course, are the educational systems, schools, universities, and things like that. And we sort of heavily disinvested in this in the 1980s, in the 1990s, because, we've sort of had an interesting trajectory in these universities. So if you take University of Nairobi or Dar es Salaam or Makerere or University of Ghana or University of Ibadan, in the 1950s, 1960s, 1950s, for those that were in existence then, or 1960s, even 1970s, these were sort of universities of excellence, where you had the brightest African minds, often even the brightest people studying Africa from around the world, teaching in those places and doing research there as their primary places of work. If you look at many of those universities, they are no longer in that place.
Yes.
And a lot of it has to do with the slow decline of African states, with economic crisis, political crisis. But a lot of it was also just deliberate decisions made during our structural adjustment programs. There has been an interest in sort of rebuilding this, but I don't think we have, first of all, realized how big the challenge is and how big the problem is. Second, we haven't been willing to put in all the resources that are required. And third, some of the measures that we are taking are not necessarily the right measures, in the sense that the people that are involved in this debate are not necessarily, the voices that are often heard in this debate are not necessarily the voices of people that are really implicated in those spaces. And so I think we need to rethink this. It's the same with our health systems. We can think also about growing inequality. It's true that in many African countries, less people are poor, but there is growing inequality, and inequality has fundamental impact in all aspects of life. And we see it, in how we are trying to deal with the COVID pandemic. In many countries, they cannot have lockdowns, even though leaders want to, because many people will just starve. And so far more people will die from dealing with the disease than from just allowing the disease to evolve in society. And so these issues of poverty, of inequality, of health systems that don't work well, of educational system, are things that we are once again reminded that we should pay attention to. Will we do that? It's not clear. I mean, it's not obvious that this crisis will lead us to. I mean, our countries have faced many crises in the past, and they haven't necessarily led to the change that we desire. So there is a political struggle, and I think one of the things that I hope will come out of this is a greater determination of populations and active political communities in these countries to fight for change. It's a fight that has been going on for a while, but it's one that we have to continue to pursue, because the cost of not pursuing those struggles is just too high.
Thank you. Thank you, Kwame. Final question. This pandemic comes at a time when the African Union has been discussing African free trade area. In East Africa, we're talking about political federation, etc., etc. How, just your crystal ball as we close. If you looked at it and said, what are the what would be the ideal response to COVID-19 in terms of the grand project of African unity? I'm talking about the ideal, and of course, it is tempered by the reality of our history and existing knowledge.
I think, there has been agreements for a while in large sections of the continent that greater unity and coming together is probably good for the continent on many fronts. It's political, it's economic. I think in terms of dealing with health crisis, it's obvious that if we could coordinate our responses better and things like that, it will help. I think the question is, it's about continuing to work on surmounting problems. Okay. I think I'm one of those people that tends to be optimistic. I'm very aware of the problems of the continent, but I'm also optimistic. And maybe that comes from my training in comparative politics, because a lot of the time I think we tend to particularize problems that are not unique to the continent. So integration is a hard thing. It's hard to achieve. Once it's achieved, it's not something that you keep forever. It rolls back and all of that. Even with this COVID, people are talking about the European project. Just before COVID, there was Brexit and all of that. So I think, like I said before, these are things that we have to work at. And even once we achieve them, there are things that we have to keep fighting to have every day. Because these are things that are really hard to achieve. And once you achieve them, they are really hard to keep. And so we have to keep fighting. One of the things that is obvious is that the cost of not having them is extremely high. And so whatever sacrifice we can make to achieve them in terms of activism is something that we should invest in.
Thank you very much, Dr. Ato Onoma, Head of Research at the Council for the Development of Social Science Research in Africa, CODESRIA, from Dakar. Asante sana for giving us an hour of your morning to share these brilliant insights with us. Asante sana.
Karibu sana. Kwaheri ya kuonana.
Kwaheri ya kuonana. Nashukuru. Asante sana.